I think the future holds a few very important steps, especially in the near term. I think what we're going to see in 2017 and 2018 is the emergence of many more combinations that hopefully will further extend the activity of immunotherapy to a wider spectrum of patients with head and neck cancer. We've already seen preliminary data of some combinations, and over the next 18 months, that number will increase dramatically. One of the other things that we'll begin to understand is which patients respond. First to single-agent anti-PD-1, and then hopefully which patients respond to specific combinations. And then lastly, there still is an unmet need of patients who aren't responding to anti-PD-1. We're beginning to recognize some of the mechanisms around that. For instance, a highly suppressive tumor microenvironment that requires addressing of that, usually in combination. Or there are some patients where the immune system really hasn't begun to form a response, or at one point formed a response that now is completely absent. And in those patients, at least we think we're going to need a different strategy to now reactivate the immune system and re-educate it to recognize the tumor and begin to respond to it. Those strategies may include viral oncolytics, vaccines, or cell-based therapies, slightly different than the combination immunotherapies that may address a different population.
There are two major next steps for research in immunotherapy. One are attempts at integration of the immunotherapy agents into cure, and the second are novel agents and novel combination of agents. There are a lot of combination studies going on in oncology in general. And that's because there are a lot of checkpoint inhibitors, there are a lot of enzymatic targets known to be of high promise in head and neck cancer. We're starting to study innate pathways like the STING pathway. And then there are more novel approaches, engineered T cells, both autologous products and CAR T products, oncolytic viruses that might stimulate immune responses, using chemo or radiation to prime immune responses. And we're going to see all of these combined in different ways. And it's very hard to predict what the winners are going to be right now, but it's easy to say that probably one or more of these will advance the field.